Hello guys, let's discuss about abdominal TB lesions depending on various sites of involvement and what clinical features they may present with. So there are various sites of abdominal TB, like it can involve small intestine, it can involve like small intestines, then it can involve other parts like large intestine and ileocecal area, then it can involve peritoneum and mesenteric lymph nodes causing lymphadenitis. So let's discuss first about the small intestine. So if abdominal TB is there in the small intestines, the lesion it produces is mainly either initially ulcerative in nature, which may lead to stricture in later stages. So, what would be the clinical features with which the patient will present to you? So, the features will be diarrhea, then the patient will have malabsorption first. Secondly, they may have low gastrointestinal bleeding. If there is stricture formation, these initial ones are actually due to the ulcerative lesions, but if there is any stricture formation, it will lead to intestinal obstruction. So you may get features of intestinal obstruction due to decrease in the lumen size. Also, in later stages, you will get perforation. You may get peritonitis, basically due to perforation. You can get other symptoms like pyrexia, purging, and poor absorption. So these are all the symptoms starting from P, you can notice. So these are the clinical features with which the patient of abdominal TB might present to you with lesions on the small intestine. So now let's come to the next site, that is ileocecal junction and large intestines. So what lesion it may produce there? Unlike small intestine, the lesions here are hypertrophic in nature, or there may be ulceration, so ulcero-hypertrophic. So what might be the clinical features due to this? So definitely, hypertrophic lesion can cause intestinal obstruction. It can lead to a mass-like lesion. Again, it can cause lower GI bleed, and there may be fever, along with other signs of TB like night sweating, weight loss, etc. Now, let's come to the next site, that is peritoneum. If peritoneum is involved in the TB, in case of TB, there will be ascites and adhesions in the abdomen. So what will be the clinical symptoms? There will be fluid in the abdomen, so abdominal distension due to ascites first. There will be fever, weight loss, etc. And there will be intestinal obstruction. The next site is mesenteric lymph nodes causing lymphadenitis. So the lesion is lymphadenitis causing enlarged lymph nodes. So clinical features will be abdominal pain, there will be fever and weight loss. So which are very common presentation with any other diseases also, it might be there. But if three of these symptoms are present, especially fever and weight loss, night sweats, we should always suspect TB and look for it, because in India it is very common as we know it. So that's it for today.